Do you understand the risks of total knee replacement surgery? This is the second presentation for patients contemplating total knee replacement surgery. This presentation covers some, but not all, the risks and possible complications of total knee replacement surgery. This presentation is not meant to replace formal information leaflets or the appropriate face-to-face consent process, which is tailored on your individual risk factors. Complications of total knee replacement surgery. The vast majority of total knee replacement procedures go without any complications. A small minority of procedures suffer from complications either on the day of the operation or in the post-operative period. It is important that you consider and understand the risks before embarking on replacement surgery. All patients are at risk of developing complications. However, pre-existing health problems, being overweight, and increasing age generally increase the risk. Cardiac, respiratory, cerebrovascular accident complications. A perioperative myocardial infarction, otherwise known as a heart attack, is a known danger associated with the stress, blood loss, and drugs administered at the time of or after the knee replacement. A cardiac arrhythmia or abnormal heart rhythm can be very minor or very serious and occasionally results in death. A stroke can occur during or after the procedure. This is thought to be due to changes in blood pressure and heart rates. A postoperative chest infection, often called a postoperative pneumonia, can occur after the operation. This might be relatively minor or extremely serious. Infection complications. Infection is always a serious risk of surgical intervention. To lower the risk of this, we perform a thorough preoperative assessment to ensure no active infection is present prior to the operation. The operation is performed in a filtered air theatre known as a laminar flow theatre. This ensures clean air is passing over the operation site. Exhaust suits are worn by the surgeon, surgical assistant, and scrub nurse, and these prevent any infection or contamination being transferred to the wound area. As well as meticulous soft tissue handling and careful technique, antibiotics are used during the surgery to lower the infection risk further. Venous thromboembolic events, known as DVT and PE. Total knee arthroplasty is associated with the risk of developing a blood clot in the legs known as a deep venous thrombus. This clot can break off and dislodge to the chest, where it can cause the very serious and occasionally fatal complication of pulmonary embolus or PE. We try to prevent this by a number of methods, including early mobilization, compression stockings, and in some cases compression pumps. We also thin the blood, either by using heparin injections or special blood thinning tablets known as direct oral anticoagulants, usually for 14 days after the operation. Bleeding, hematoma, vascular, nerve, and wound complications. Veins, arteries, and nerves run close to the knee joint. Rarely, when a knee replacement is inserted, one or more of these can be damaged. This can cause a minor or a major complication, and in some cases it can be life or limb threatening. The wound can often leak a little blood after the operation. However, occasionally this can be troublesome and require surgical intervention. A collection of blood can develop around the knee known as a hematoma, and sometimes this requires surgical drainage. The knee wound usually fully settles by 14 days post-operation, but can take longer in some cases, especially if bleeding issues or infection have occurred. Bone damage, bone fracture complications. Rarely the bone can be so excessively soft or brittle at the time of surgery that bone damage or fracture occurs during or after the operation. Sometimes this results in a more complex procedure being carried out, or possibly a secondary surgical procedure being needed. Poor range of movements and weakness complications. After a knee replacement, we expect a functional range of movement in the knee. This is usually not as full as a normal knee prior to the arthritic process. If a patient has a poor range of movement prior to the operation, i.e. cannot straighten or bend the knee well, it is likely they will still have some residual deformity. At the time of the operation, every effort will be made to maximize the movement, and it is then expected the patient will work hard for the next 12 to 16 weeks to maintain and improve the movements. If the quadriceps and/or hamstring muscles are weak prior to the operation, they are often found to be even weaker immediately after the operation. It is essential the patient works hard for the 12 to 16 weeks after the operation to regain and improve the power in the leg, get the maximum benefit from the operation. Wear and loosening complications. When we put an artificial joint in the body, it will wear with repeated use. Hopefully this will not occur for many years. Usually after many years, microscopic wear debris from the knee replacement can cause an inflammatory reaction that causes loosening of the implant. This can result in the need for a redo or revision procedure. Numbness on the outer side of the scar. It is entirely normal to have decreased sensation on the outer aspect of the knee after a knee replacement. The area involved usually decreases over a period of 12 to 18 months. This area of numbness should not cause any functional problem. Kneeling after total knee replacement surgery. After a knee replacement, patients often ask if it is possible to kneel again. Modern knee replacements are designed to allow kneeling, however it will feel uncomfortable at first. With practice, most patients can kneel, but about 1/3 find it too uncomfortable. There is evidence that the sooner you try, the better the chances are of being successful. Amputation and death complications. Rarely, a complication can be that serious, such as a vascular complication, infection, or nerve damage, that amputation is needed. This is a rare but devastating occurrence after knee replacement surgery. Death can occur after knee replacement surgery. This is usually associated with the complications of a cardiac event, such as a heart attack, or an embolic event in the form of a pulmonary embolus. Despite all our efforts to decrease the risk, it is still present. Reducing the risk of complications. We do our best to reduce the risk of complications by performing a thorough preoperative assessment, by giving perioperative antibiotics and DVT and PE prophylaxis, by using good operative techniques and careful perioperative monitoring, combined with rapid rehabilitation. This reduces the risk, but they still will be present. Questions. Please ensure you are happy that all queries and questions are answered before surgery.